Hands up anybody who's heard of the Brown sound theory before. It's a subsonic sound wave frequency that when you hear it initiates neural and structural mechanisms that causes involuntary defecation. In other words, it makes you poo yourself. Who wants to try it? Some of you are looking pretty uncomfortable. I saw you. That's because that was pretty weird. But the point is, sound is powerful. It's powerful. It's so, so powerful. I'm sure some of you can smell that by now. But for medical doctors, sound is vital because in the form of ultrasound, we can see inside the body. By shooting high-frequency sound pulses into the body, we can build a picture of the body and what's inside the body based on how the sound bounces into the body, off the tissues, and back into the probe. For me, and for many others, we think of medicine like a war. We're at war. Cancer is one of the big boss baddies. And to destroy cancer, we need to do two things. We need the power to kill it, and we need the vision to see it. The first weapon in our armory is surgery, slicing, dicing, and cutting whatever it is out. But the problem is you bleed a lot. You need anesthetic, and lungs and your heart really don't like anesthetic, and the surgeon might cut out the wrong kidney. Believe me, it happens. The second weapon in our armory is chemotherapy. Pumping medication into the body to seek out and find those cancer cells and to trigger cell death. But the problem is these medications are toxic. It's like sending a nuclear bomb into the body, into a city, but destroying a whole country instead and leaving damage forever. That's where sound comes into the equation. No, not like that. I'm talking about MRG FUS, magnetic resonance image guided focus ultrasound. No needles, no stitching, no knives, no anesthetic, no bleeding, just sound. Focus ultrasound is like using a magnifying glass to focus sunlight on a target to heat it up. It uses an acoustic lens to focus multiple beams of ultrasound on a target. Each beam of ultrasound has a little effect, but the point where they focus on that point, it releases energy in the form of heat, and that destroys that tissue in a process called coagulative necrosis. Magnetic resonance image guided focus ultrasound is so mind-bogglingly amazing. You can use it for many, many different medical applications. So the next time someone asks you, what's all the fuss about? You tell them, the fuss is about MRG FUS. I'm done.